Since we introduced this technology in our practice, it's been an absolute game changer in our practice. We've been interested in phototherapy for many years. In fact, from the time our practice started, we've been offering phototherapy. But that was in the form of UVA and UVB. And when this technology came out, the first thing we noticed that there was a very rapid improvement in the conditions that we were treating. So we were treating psoriasis, we were treating eczema, we were treating vitiligo, alopecia areata. And just to give you an example, where it took us 1 year to make a difference to a patient with vitiligo, we were seeing differences in vitiligo within 5 treatments. And this was absolutely phenomenal. We took patients who had psoriasis, they had equal lesions on both legs. We wanted to see whether the technology works. So we treated a small area on one leg to compare it with the other. We found within 3 or 4 treatments, the psoriasis was completely flattened out. We had patients with eczema that suffered from eczema for years, some of them even for 10 years. And we treated those patients in a small area with the excimer technology and flattened those chronic areas of eczema completely. I was convinced that this technology worked and we had to introduce this to the practice. Since then, there was no turning back. Excimer has formed a very important part of our practice, and we treat many patients every day who just love the technology and enjoy the results that they get with it. But I don't have to personally get involved in administering the treatment. It's so easy, it's so light, it's so simple to hold that our staff is completely trained in running these machines. And you don't even have to run the machine. All you do is hold it, press it on, and it's done. Of course, it's done under my supervision. So I would determine the dose, and if there are any problems or any side effects that the patient experiences, I would view the patient myself. And whenever the patient needs to see me, I would pop in and see because it's done in the room next to me. Well, I think the one thing that doctors need to realize that the indications for excimer are so vast that they don't have to look for patients. Patients that are coming regularly to their practices are the ones that need excimer. I mean, you might think the patient's psoriasis is too extensive, and so the patient is not going to be a candidate for excimer. But if you consider that even patients who have extensive psoriasis may have areas of psoriasis on their hands or on their faces where they can't take 30 treatments of ultraviolet light to fix, those are the places that one needs to use excimer. So the point is that they are ready-made patients in their practice who would use the technology. So that's one factor to consider, that they won't need to look for patients. The patients are there already. The second factor to consider is that it's a machine that pays itself off because there are many patients. The cost of having the excimer treatment justifies the possession of such a device, and it pays itself off very quickly. Another factor to consider is that this device occupies very little space in the practice. I mean, if you look at this is the amount of table space you need to operate this device. And it's a very small amount of space that one can introduce in the practice. A new device, a new technology that patients love, and yet it's not a huge space occupying device.